Good morning. Thank you for letting me get up here and talk about one of our tools that we developed recently for the CLL watch and wait population. I cannot actually take credit for this tool personally. That was the development was led by Lorna Warwick when she was with Lymphoma Canada, although I was assured that she was not on the committee that chose this. So as we learned yesterday, through many discussions, the watch and wait period for many people creates a lot of anxiety and stress, and leaves patients with a lot of questions and feeling incredibly isolated between their visits and their consultations, which often are 6 months apart. And they feel like they have no one to talk to and no support. And obviously, selecting the right time to begin treatment and also the types of treatment are very important decisions. And there are many patients that want to be involved in that decision and take an active role in determining the timing and selection of their treatment. And we at Lymphoma Canada do believe that an informed patient is an empowered patient. And so we did develop an online tool to help patients in the watch and wait period. And I should note that this is obviously just one tool in a growing toolbox of support for watch and wait patients. Obviously, every patient is different. Everyone needs slightly different support and coping mechanisms. And so this is for those patients who really do want to be involved, to do something. And really keep track of how they're doing and their symptoms. And so this online tool, this web application, identifies and captures patient-reported symptoms. And then it also provides some online support through built-in information, pop-up messages that are based on what the patient inputs to help them understand any symptoms that may need to be reported to their doctors. And what the tool enables CLL patients to do is to self-manage, to track their symptoms and monitor their progression during the watch and wait period. And this should help them also have better conversations with their physicians and care team. And so, as I mentioned, this is an app that can be downloaded on any mobile device. It has a very simple user interface. It was developed for an older population, given the median age of CLL diagnosis. User-friendly, easy to use, simple, straightforward, with the interactive components, the tracking and appointment calendar, front and center in the app. We did also create a standalone website, obviously that people can use in any web browser for those who either don't have a mobile device or are more comfortable using such a tool on either a larger screen or on their desktop computers. And so, as you can see, the main components of the tracker are the data entry for the symptoms, as well as there is an appointment calendar for patients to keep track of their appointments. But there are also, other pieces of information, including a little bit of information on what watch and wait is, why it's important to keep track of your symptoms, some frequently asked questions, some basic information about CLL and SLL, as well as information about Lymphoma Canada, how to contact us, and where to get more information. So the tracking component, the questions are based on the IWCLL guidelines or indications for treatment that are in the guidelines. And it includes questions about physical signs and symptoms, including, obviously the obvious ones: enlarged lymph nodes, fatigue, night sweats, abdominal pain, weight loss, appetite, fever, and illness. We also added an emotional health component so that people can keep track also about how they're feeling in terms of their happiness, sleep patterns, such things that will also help their care team manage their emotional health, them and their care team, I should say. And then we also do have an area where they can enter their most recent blood test results, their CBC numbers. And obviously the tool does not provide medical advice, but patients will get alerts suggesting they take certain actions, either making an appointment in the next couple of weeks with their physician if they report certain symptoms repeatedly and to a certain level. So this is just a screenshot of what the patients would see and how they enter the data. Very simple, straightforward. It's just you can enter. This is one asking them to describe their level of fatigue during the past week, and it's just a sliding scale. They submit the answer, and then they can also get a snapshot of their input over the course of 1 month, 3 months, the last 6 months, or the past year. And these, at the moment, it can also be. They can obviously be printed out to take to your appointments, or they can be shared on your device with your medical team at your appointments. So in terms of the initial evaluation of the tool, I should say the development of the tool occurred with the consultation with a CLL expert in Canada, a clinical expert, as well as a number of patients were involved, consulted during the development of the tool. And then the first phase evaluation involved a pilot study with about 50 patients, using it over the course of about 6 weeks. And overall, patients found it very helpful for tracking symptoms, and they believed it would help them make better informed decisions about their care and their treatment with their doctors. The patients who found it most helpful and most useful were those who were more recently diagnosed, those who had perhaps less experience, less knowledge about their disease and their symptoms, and had been living with it less long than others. We will be adopting a few of the recommendations that were made by a number of the patients to make it a little bit more user-friendly, some notifications to remind people to input data if they've forgotten or they haven't in a week or two, and then also more flexibility with the frequency of data input, among other things. Thank you.